I just came back from chemo. After this, I'll have only one more session. I thank the Lord every morning that I wake up when I remember that He saw fit to wake me up. Cause side effects for chemo usually kick in 3 days after I get it. So 2 to 3 days. So for now I'm okay. But I have noticed that there's a rise in black women with cancer. And the lifespan after being diagnosed with cancer is 5 years. And I got diagnosed in December of 2023. And I'm hoping to beat this, to live a healthy life so that I can live to see my granddaughter grow up. And on top of that, I have a cousin in D.C. who went grocery shopping the other morning with her daughter and son-in-law. She fainted. They said when she fainted, she immediately started snoring. She haven't woken up since. And as soon as I got back from chemo, my mom told me that they pulled the plug.
I can tell that they all scared of revolution. They ain't even trying to find out a resolution. I'm talking heal the body, free the mind, evolution. They don't really understand, man, they never do it. They acting all stupid.
Tone and turn up. Love the Buzz Tweet Talk Radio videos? Drop a like. Let us know your thoughts in the comments. Hit that subscribe button to stay in the loop with all our buzzing content.
What is up, y'all? You're listening to B Sparrow on Buzz Tweet Talk Radio.
So yes, just came back from chemo. Got one more session to go. So, black women have higher rates of cancer and lower survival rates than any other racial and ethnic groups. It didn't used to be like this. Breast cancer. Black women are almost 40% more likely to die from breast cancer than non-Hispanic white women. The U.S. Preventive Services Task Force lowered the recommended age for starting mammography screenings to 40 for black women due to high death rates. It's because they're killing us. I told y'all about the doctor prescribed me a drug that was for psychotic. It was for the brain, for mental. And I don't know why she prescribed that to me. I didn't even ask. Stomach cancer. Black women are twice as likely to be diagnosed with stomach cancer and 2.3 times more likely to die from it than non-Hispanic white women. Uterine cancer, which is what I was diagnosed with. Black women die from uterine cancer at twice the rate of white women. It's because they take care of their white women. They don't care about what we say. They don't care about what we feel. They don't.
Buzz Tweet Radio. You're listening to Buzz Tweet Radio.
Colorectal cancer. Colorectal cancer. Black women have higher rates of colorectal cancer than white women. Overall cancer, black people have the highest overall cancer death rate and a lower 5-year cancer survival rate than white people. Is this part of the curse in Deuteronomy 28? Black women are more likely to be diagnosed with breast, lung, and colorectal cancers at a late stage. A 2017 study found that lack of private health insurance accounted for 37% of excess mortality risk in black women. The doctor told me today that they have more medicines than ever to treat cancer. She was kind of saying it's a good day for cancer patients, really. This is the same lady that gave me, that prescribed me medicines for mental health, for your mind. And that's not what I need. A 2017 study found that treatment differences accounted for 4.8% of the excess mortality risk in black women. This shows me that they don't take care of us. When you hear someone say that doctors don't listen to black women, it's true. I've been through it myself. They don't listen to us, which means to me that they do not care. So we have to start taking better care of ourselves, because no one else is going to do it for us. So this article says black and white women are equally likely to be diagnosed with breast cancer, but black women are 40% more likely to die from it. Black women are also twice as likely to be diagnosed with stomach cancer as white women, and 2.3 times more likely to die for it. That's because they are taking care of the white women. I got a letter in the mail from the Cancer Institute. Saying that they wanted to do some research on me. So they would pay me up to $20 to $100. I declined. No, thank you. No, thank you. No, thank you. I can do bad by myself. The largest study of its kind to investigate why black women are more likely to die from cancer, from most types of cancer. Is that what they were studying? The American Cancer Society said that it is seeking participants for what may be the largest national study of its kind, one that aims to solve the mystery of why black women have the lowest survival rate of any racial or ethnic group in the U.S. for most cancers. Thanks to new medicines and better detection, cancer deaths in the United States have been declining since a peak in 1991, but black women have the highest death rate for most cancers. The racial differences are especially stark with certain types of cancer research, of cancer. That's what research shows. For example, black and white women are equally likely to be diagnosed with breast cancer, but black women are almost 40% more likely to die from it. Black women are also twice as likely to be diagnosed with stomach cancer as white women, and 2.3 times more likely to die from it. Yet, black women have historically been excluded from most clinical research that has focused mostly on white men. I think this is the research that they want to do on me. The Voices of Black Women study hopes to recruit at least 100,000 black women from 20 states and the District of Columbia to follow for 30 years. 30 years? The study is concentrating on these areas because they were 90% of U.S. This is where 90% of U.S. black women between the ages. Okay, I had to take that call and I kind of lost my train of thoughts. So I was reading this article. It says, twice a year the study will ask participants about lifestyle factors, medical history, and experience of racism to determine what might affect someone's risk of cancer and dying from cancer. To be eligible, participants must identify as black and women, be between the ages of 25 and 55. So that excludes me because I'm 56. And not have a history of cancer, with the exception of basal or squamous cell skin cancer. More information on joining the study is available on the Society's website. As the American Cancer Society team constructed the study, it said it was mindful of the long history of mistreatments and abuse of black women's bodies used to benefit science, yet black women have received the fewest benefits compared to their male and white counterparts. So they study us to save them. Ain't that about some...
You're listening to B Sparrow on Buzz Tweet Talk Radio.
They study us to save them. Past population studies from the American Cancer Society have helped transform scientists' understanding of cancer. It's largely because of an American Cancer Society study that scientists understand the link between smoking and lung cancer, for example. The organization hopes to see a similar breakthrough with this newest research. Voices of Black women represents a crucial step towards achieving health equity in a population that is long overdue. Sure, you're right. They don't care about us. Goes on to say the data we've uncovered through previous population studies have been critical in reducing the unacceptably high burden of cancer. But the reduction has sadly not been equal. By centering Black women's voices and experiences, we can dig deeper in uncovering the unique challenges and barriers contributing to cancer disparities and develop tailored interventions to mitigate them. No, thank you. I will pass. What do y'all think about this? Will y'all participate in a study like this? Let me know below. Like, comment, and subscribe. It's your girl, B Sparrow. Buzz Tweet Talk Radio, y'all. Holla at y'all girls, okay? Well, okay.
I can tell that they all scared of revolution. They ain't even trying to find out a resolution. I'm talking heal the body, free the mind, evolution. They don't really understand, man, they never do it. They acting all stupid.